Hi there. This week I'd like to talk about empathy or the lack of it, especially in the healthcare and first responder and public service community. Had some really interesting conversations with some colleagues that are former police officers and EMT paramedics about empathy and the lack of it that begins to happen over time. This conversation was really started because of the incident in Aurora, Colorado, where four black children were forced out of their vehicle and then forced to lay face down on the pavement. Of course, there was a lot of public outrage about this. How could this happen? Another incident of police brutality. The other side of the coin that we talked about was how these officers and other people that deal with the public, their empathy tank is on E. In other words, it's empty. And a lot of times the culture will reinforce this. I know I've talked to EMTs before, and their culture reinforces this idea of you don't lose it on scene. Of course, you don't lose it on scene. You have to take care of business. But unfortunately, that kind of invades the culture and the thinking. And so the consequence of that is that people then numb out. In fact, in the post-traumatic stress world, it's called psychic numbing. It's a fairly common phenomenon. After a while, you just don't feel anything. Sadly, you don't feel joy, you don't feel happiness, and that then begins to impact your social life and your family life. So really we need to learn how to practice the skill of empathy. And there are some things we can do to, in fact, increase our empathy. One of the things is to recognize our own emotions and our own biases, and we all have them. And it's having a humble understanding of what are those things and how do they impact me and in my work life and my personal life. The other thing is to interact with a wide variety of people and to do that consciously because, and this happens in healthcare, we tend to police interact with police. EMTs interact with EMTs, physicians interact with physicians, and we really don't get a broad perspective of seeing other people's point of view. Another really simple thing you can do is read good fiction, because if we get engrossed in the characters in the book, we have to empathize with them. We have to think about them and what they're doing and why they're reacting. Another skill is to listen to people without judgment and without giving advice. And I would say healthcare people especially, we're always there to help and jump in and give advice, rather than just practicing the skill of listening and listening without judgment. The more we practice these kind of skills, the better we get at them. And I believe that we can cut down on the incidents like what happened in Aurora. So think about your empathy. Are you able to do that? And what kind of things you can do to increase and maintain your empathy? Because it is a resiliency skill. In fact, we have a whole chapter in our book, A Community of One, Building Social Resilience, devoted to that topic. It's that important. So have a good week, and I empathize that y'all are having a tough time. We're all having a tough time. But remember, it's our beliefs and our ability to relate to one another that's going to save us. All right? Take care.